coaching chronic conditions. Today I will be talking about the chronic condition atopic dermatitis, which is also referred to as eczema. I'm going to be explaining what atopic dermatitis is and then get into my client's information. So eczema is a non-contagious inflammatory autoimmune skin condition that weakens the skin's barrier. It is sometimes hereditary. There is no cure, but some children outgrow this condition. My client did not. They are an adult still suffering. It is characterized by red, dry, itchy, and sometimes swollen skin. Individuals can be susceptible to bacterial, fungal, and viral skin infections since itching can open up the skin and cause germs and things to get inside. Dermatologists can diagnose and create treatment plans to manage and control flare-ups, but there is no cure to this disease. Treatments can include reducing stress, preventing infections, and preventing skin thickening. The causes can be an allergic reaction to touching something or coming in contact with chemicals, and then it can also be caused by ingesting something out of sensitivity. We will be talking about the client's possible causes later on. So onto my client. They have suffered with atopic dermatitis since birth, or as long as they can remember. They've tried many treatments throughout their life with no significant improvement in their condition. They've attended both a general practitioner, so their family doctor, and a dermatologist, and they both gave similar treatment plans and advice. So they both said the same things like oatmeal baths or making prescriptions for the exact same ointments. They have encountered infections due to this disease because of itching and opening up the skin. They suspect that their body is always attempting to repair itself because it's dry and itchy and the disease causes harm to the skin, and they think that this is causing chronic fatigue and more susceptibility to other illnesses. It is appearing on the client's fingers, inner elbows, face, and neck, and in patches on their legs. The client has tested low in iron many years ago, so they were taking iron supplements as well as B12 supplements to absorb the iron better. But they have not been tested in a very long time, and they haven't been taking the supplements in a very long time, so this could be a cause of the fatigue, but they are unsure. They have no other chronic conditions as of right now, but in their family, they have cancer, heart disease, and diabetes, so this is something that they are going to keep in their mind as they grow older. Here I have 3 pictures that my client has allowed me to show for my presentation. So on the left, this is a picture of their leg and the circular formations of eczema that has appeared within the last year of their life. It is very dry and itchy, and it's almost like a bump on their skin. It raises out like it's swollen. The bottom one is a picture of their neck, and this is something that has been very frustrating for them recently. The redness is constant, and they can't really find anything to prevent that red and itchy skin. Out in public, it does cause a decrease in confidence since people have asked them if they are having an allergic reaction or if they're okay. So this is a spot that they're really struggling with. And then the top picture on the right is a picture of their inner elbow. This is a spot that they've had eczema for almost their whole life. You can see that it goes all the way down their arm. It's very inflamed, red, dry, and itchy. This is a picture that they took after exercising, so they think that the sweat and the dry environment may cause it to worsen. So we're going to talk a little bit about this later since it is going to be one of their goals. Here I have some other information about my client that I got while interviewing them. So they are 24 years old. They currently participate in high-intensity physical activity about 4 to 7 days per week. They attempt to go on daily walks. They focus on their diet, so they attempt to ingest a nutrient-dense, healthy diet, although they do indulge in treat foods, but in moderation. They drink about 1 to 3 cups of coffee per day. They explain that basically they don't go a day without coffee. And then they also admitted to thinking that they do not drink enough water each day. Here I have some information about the medications and naturopathic products that my client has used. They are currently using Protopic, which is an ointment that was prescribed to them by both their dermatologist and their family doctor. It helps relieve some of the discomfort that atopic dermatitis causes them. It lowers the redness over their skin and sometimes the itchiness, but mostly just prevents the red from showing up on their skin. They choose to not use steroid products because of the side effects. They used other products such as hydrocortisone that caused bleaching of their skin, and they think that steroid products just have even worse side effects, so they choose not to use them, even though it's a common treatment for atopic dermatitis. And then here's a small list of other products and ointments and creams that they've used throughout their life. So this includes aloe, mineral oil, petroleum, hydrocortisone, and then for a short period of time they needed medicated shampoo since their eczema showed up on their scalp. 3 goals that the client came up with during the interview are that they want to remove gluten from their diet to test if they have a sensitivity. They want to include meditation into their daily routine to help reduce stress. And then they want to find a way to prevent flare-ups during and after exercise. Fortunately, my client does not have any physical activity impairments due to their condition, just discomfort. So their skin does get a lot more red, dry, and itchy when they are being active. This is possibly due to sweat, loss of fluids, increase in body temperature, or possibly the dry environment if they're in a gym. This does cause a decrease in confidence because it does get so red, dry, and itchy that people do notice it and they ask what it is, if they're okay. And the client doesn't really like that. They wish that their skin did not get red, obviously. So they do want to work towards finding strategies to prevent this flare-up that happens when exercising. So they've tried wearing long sleeve shirts to cover their arms or putting on certain products before or after exercise. They haven't really found something that works. So this is kind of a goal that's been going on and they want to continue working towards it. I did include it in the next short and long-term goals just because it's something that they're doing through trial and error, and they will work at this over time, possibly forever or until they find something that really works for them. So this is the start of my coaching plan for my client. I'm going to start with the short-term goals. So first, they want to replace gluten items in their diet to remove it altogether. They've learned that gluten can be a cause of eczema and worsening symptoms. So this is something they want to try in the near future. For a time frame, I would say they could go 1 week with attempting to remove items, and then at the end of that 1 week, they're going to have no gluten in their diet whatsoever. After 2 weeks of having no gluten in their diet, it should be gone from their body, and then they can see if there's any changes to their symptoms and their skin condition. Their second goal is to meditate for 5 to 10 minutes per day. For a time frame, this can be started immediately once they feel motivated to do so. So I would say 1-2 days once they can get started, and then after a while they can increase their time each day if they wanted to do so. This is based on the client's goal. There's other goals that I could recommend or suggest to them as we work together over time. So I would say get patch tested or allergy tested, and then removing chemicals from their life and home, such as laundry detergent or perfume, makeup, that sort of thing. Using a humidifier to open up their pores, and then keeping a trigger diary so that they can really determine what the cause is of their worsening symptoms. I could also suggest increasing their water take each day so that they could be well hydrated. And then I also think it's important to try one strategy at a time so that they know what's causing the reduction or the increase of their symptoms. For a long-term goal, they came up with the idea to find what triggers their symptoms altogether. So this would be over time. I would say it could take months up to a year to really narrow down what causes their symptoms. I would also suggest adding into this goal finding products that work for them specifically, because everybody is different. They may need something different to another person they know with eczema. So gluten, I would say in the last slide, it would take about 3 weeks to notice a difference. I would say it would take up to a year to notice things, because the next one they might want to try is dairy, or they might want to try chemicals within the home, such as cleaning supplies, that sort of thing. So it might take a long time to really narrow down what's causing them to have flare-ups. As for areas of expertise, I wouldn't say that I'm necessarily an expert in any area, but I do have a few areas that I do feel very comfortable in counseling and coaching people in. So the first one I put is counseling. So this program strategies to keep people motivated and working towards their goals, and all of the strategies that we've been practicing throughout this year at Humber. And then next, my undergrad in health and physical education. I took courses in fitness, nutrition, anatomy, physiology, that sort of thing. So I do feel like I have a strong education in those courses, and I do feel comfortable coaching my client or giving them recommendations on, physical activity or nutrition and other areas that I learned about during that program. And then aside from education, I currently work for Sick Kids Hospital, working with patients with multiple sclerosis. So I work with them to increase their physical activity for a research study, and then help them noticing changes in their symptoms. So I can relate that work to working with this client, since they both have diseases, and we're trying to find what helps relieve their symptoms. As for dermatology and skin conditions, I am not an expert. This is something that I would not counsel my client in. This is definitely something that I would refer my client to an expert to get prescriptions and referrals and education. Here I have 3 places that I would recommend my client go to for a healthcare professional. So first is a dermatology center in North Bay. It's local to my client. They are an expert in skincare. They have clinical trials available for atopic dermatitis, and it would be a good place for my client to go if they wanted prescriptions or more information about their disease. Second is a very similar one to the first one. It is just a little bit farther away if the client was willing to travel for possibly a healthcare professional that is more experienced in their disease. If they were willing to travel even further, I may suggest a place in Toronto, since there are more places available and there may be an expert that is more experienced in atopic dermatitis and able to help them better. The last one there is acne and eczema, which is an online counseling business. They are naturopaths that are experts in eczema and acne, so I would recommend my client go there because the naturopaths that own this business have suffered with eczema themselves, and they work with patients with atopic dermatitis daily, so I think that they would be experts in this disease and could really help my client. And online is pretty convenient. They can talk over video and share pictures and that sort of thing, and I think my client could really benefit from seeing them. As for their diet, I could refer my client to a nutritionist or a dietitian to get an expert opinion on their diet, on gluten and dairy or whatever else they want to take away from their diet to notice if it's a trigger. Since I'm not an expert, I would find someone that would really help them with that specific thing. Here I've given 3 online resources that I could give to my client if they wanted more information about their disease. So the first one, Eczema Help. It includes information about eczema. It has some products that are safe to use, and then it also has a link to find a doctor near the client. Of course, I will be making referrals for the client, but if they choose to do it themselves, it's there for them. National Eczema is the next one. It has general information about atopic dermatitis. It gives causes and triggers. It gives information on managing the itch, and then it also gives information on related conditions. And then the final one there, Eczema Exposed. It includes discussion guides to help the client talk to their doctor or specialist. I think this is a really great resource for individuals who may have social anxiety, or they may just forget to ask certain questions that they wanted to ask when they're talking to their doctor. So it gives like a little printout that they can take with them so that they remember all the information that they wanted to ask or be educated about. So my final slide here for my coaching plan is about the care partner or social circle for the client. So I feel like the social circle does not need specific training or education for this disease, since it's not life or death like other conditions are. I would say if they wanted to help and be there for my client, they could educate themselves and just become more aware of the condition so they can make the client feel more comfortable, with the flare-ups or the red skin or, having itchy skin. And then they can also help them in regards to like helping them avoid triggers in their life. So say they're going out to eat, they can help them, stay away from foods with gluten in it or whatever they're trying to avoid at the time. They can also help them write in their trigger diary if that's something that they're practicing, because that can really help reduce flare-ups.